Yeah, Matthew, you can start sharing. Yeah, make it full screen. It's visible. Yeah.
Yeah. Thank you, sir, for this opportunity. Well, I will be sharing my experience with this new molecule. I don't have any financial interest. Well, let us come to the first case. This is a 68-year-old male patient, a medico himself, a physician, had a blurring of vision since 5 months, and the vision in the right eye was 660, and the left eye was finger counting 2 feet. On dilated fundus examination, this patient presented with actually bilateral CNVM. As we can see in the OCT, the right eye OCT shows an active CNVM. The CMT was 341 microns. And the left eye, as we can see, there's a stream-like structure, and the CMT was 421. Well, as we know that the presence of stream, the visual prognosis is not that great. We straight away advise this patient the left eye eccentrics. And the right eye, I had given an option of aflibercept or brolucizumab. And he being a doctor, he actually decided for the new molecule. And we were also actually keen to see what is the effect of this new molecule. Although this is not the ideal case to start with, this happened in the October 2020. But lucky for the patient, after the first dose, there was a significant reduction of the CNVM lesion, along with the improvement of vision. We rarely get patients happy after the anti-VEGF injection, as in the CNVM case at least. And this you can see in the left eye after Accenture's injection, the vision didn't improve, but obviously the fluid component has reduced. But at this time, we didn't know the durability of the medicine, and we were going along with we are actually following the Hawk and Harriet trial. So I actually advise loading dose for this patient. And this is after the second dose. You can see after the second month of treating this patient with a brolucizumab, vision further improved to 624, and there was a dramatic reduction of the lesion itself. It's almost completely a resolution of the lesion. And the left eye, we didn't treat much because there was no fluid at all. And this is after the third injection. There was even better, like it was from 624 to 618, it improved. And CMT became almost normal. And the patient was so happy that he actually convinced me to give an injection in the other eye. I actually gave one injection in the other eye. The patient, anatomically, there was not much of a difference, but patient was symptomatically better. After that, almost 6 months has passed. We have followed up frequently this patient, but there is no reactivation. With the loading dose, he is doing absolutely fine. And if I summarize, this is a treatment naive patient with a CNVM. This was the presenting OCT, and after 3 doses, this is the OCT. And from 660, the vision improved to 680. Coming to the second case, this was a 66-year-old female patient, dimness of vision, sudden dimness of vision on the right eye for a week's time. And we saw there was a right eye, there was a subretinal bleed. By this time, actually, I had given already Peganex, and I was very much excited to try this for a PCV bleed, because this most likely was a PCV, because as you can see the thumb-like PED and the subretinal bleed. Clinically looks like a PCV. So we planned for an brolucizumab in this injection and in this patient. And within a week's time, this patient was an outstation patient. So I actually called this patient before she was leaving. And within a week's time, actually the PED reduced and the subretinal hemorrhage has started subsiding. And from finger counting, actually it started improving. It was 1/60. And when this patient came after a month, the PED actually dramatically reduced. The subretinal hemorrhage has has been decreased, although there was a little bit of subretinal hemorrhage. Then also the vision improved to 660. This patient also we gave a loading dose. This is after the second dose of Peganex. In the second month, you can see the vision improved to 636. The PED height has even decreased. It's almost subsided. So if I summarize, this is also, we have given this, it is a treatment naive of most likely a PCV bleed. From finger counting close to phase, it improved to 636 after 3 loading dose. Now coming to the refractory cases or the recurrent cases, this was a 62-year-old male patient, had an active CNVM in the left eye or a PCV. I will come why I have put oblique PCV. This was the presenting OCT. And this was in June 2020. And after 3 loading doses of Accentrix ranibizumab, it actually responded pretty well. It was 618 and there was no fluid. I was just following up this patient. But what happened after 6 weeks, there was a recurrence. And here we can see a notched PED. So most likely this might be NPCV. That time we were not doing an invasive test due to the COVID times. But this time we actually gave brolucizumab, and after 4 weeks of giving the brolucizumab, actually it again improved to 612. Until now, it is maintaining. 3 months has passed. So this is the summary of the third case. It was a recurrence after 3 doses of ranibizumab. This was the presenting OCT, and after one single dose of brolucizumab, it improved to 6. Actually, it will be 18. Coming to the fourth case, this was a 64-year-old female patient. This was also a case of a bilateral CNVM, although the right eye had almost a scarred CNVM with a little bit of SRF, and the left eye was an active CNVM. The right eye, we planned for a single dose of ranibizumab, and the left eye, we gave 3 doses of aflibercept. This was the presenting OCT, and this is after giving 3 doses in the left eye. You can see the vision has improved to 612. And the right eye, as it already scarred, there was no further improvement, and we also didn't give any further injections. But similar thing happened in this patient also. After 6 weeks, there was a recurrence, and the vision again dropped to 660. We shifted her to brolucizumab with a single dose, responded pretty well, improved to 612. But after 3 months, again the fluid started coming up. The vision dropped down to 636. So we gave a second dose of brolucizumab, and this is the picture after 4 weeks of giving the brolucizumab second dose. Was maintaining pretty well. Again, after 3 months, the same thing repeated. So, but till 3 months, actually she was doing fine. And this is after the third dose, it's almost like normal 618 vision. So she is undergoing a cataract surgery. So this is the summary of the fourth case. This was a recurrence after 3 doses of aflibercept. After 3 injections of Peganax, this is the last picture, which looks pretty like a normal OCT. Coming to the last case, this is a 78-year-old male patient, had a dimness of vision in both the eyes, right, left greater than the right. Right eye was diagnosed with an active CNVM, left eye the scarred CNVM. He was actually getting an aflibercept injection every 6 to 12 weeks, 6 to 8 weeks, because till 4 weeks it was fine. 6 weeks, 8 weeks, the fluid was coming. So this was the picture after 7 doses of aflibercept. Still the fluid was there, and the vision had dropped recently. Had given a single dose of brolucizumab, and actually there was improvement in vision. And not only that, actually it becomes stable. Now also I didn't repeat any further brolucizumab to that patient. So summary of the 5 cases: the first 2 cases were the treatment naive patient, treatment naive CNVM, treatment naive of a PCV bleed. Next 2 were the recurrent CNVM, that is post-Lucentis and post-Lilia. And the last one was the refractory CNVM. And all the cases, all 5 variety of cases actually responded pretty well, both in terms of reduction in the fluid as well as the visual gain. We actually did a study, as Lalit sir was just mentioning. I myself, along with my colleagues at Disha, Dr. Devdulal and Dr. Boral, we did this study of the, we actually tried to, as Hawk and Harriet didn't include the Indian eyes, we tried to report the efficacy and the safety on the first 100 patients which we treated. So this was around 94 eyes, 20 were treatment naive, and 75 were refractory cases or underwent the switch therapy. 126 injections were given in a period of a minimum follow-up of at least 2 months. And this is the result, as Lalit sir was mentioning, in the refractory cases, not much of a difference, but still it was statistically significant. But treatment naive patient, definitely there was a significant difference in the BCVA gain. As far as the CST reduction was there, it was also statistically significant, and the mean interval of the repeat of injections, as most of the cases were refractory, it was 10.2 plus minus 1. It's roughly around 2.5 months. Indian experience till yesterday, I had actually inquired from the Novartis person that there was 5,500 injections been performed. There is 30 cases of IOI, of which one has been reported by Dr. Raja in IGO. Mostly they are not that severe. It has been conservatively treated, and the indication mostly uses AMD and PCD. So the take-home message, obviously, as everybody has concluded, it has immense drying effect, whatever fluid it is, intraretinal, subretinal, PED, and the central macular thickness. Luckily for me, I have used more than 100 injections. No patient actually showed any post-op inflammation, but I'm absolutely not reluctant with this medicine. I actually do a very frequent follow-up because there are incidences where there was a vitritis which was detected early and treated conservatively. So we need to follow up this patient very frequently. But definitely time will say whether this is a first-line choice, whether it is safe and most effective drug in the treatment of wet AMD and PCD. Thank you.